Hello everyone, it's Dr. Dave. Hopefully you're all doing well. Looking forward to your day today. Maybe if you're in Canada, you enjoyed a long weekend. And otherwise, hopefully if you worked yesterday or didn't have a long weekend, you had a good start to the week. And for the rest of us starting today, we're coming at you on behalf of the Toronto Neck and Back Pain Clinic with your daily health update for Tuesday, August 3rd, 2021. Going to look at 6 areas of health and wellness news and information somewhere around this video. You can read through all 6 areas. If you'd like a copy or you have any questions, you can DM us on social, give us a call here at the clinic, or even send us an email. We'd be happy to help you out as always. Not going to treat, diagnose, prevent, or cure any illness or disease with our time together today. However, our intention is to give you some brief updates based on the health and wellness literature and research that's out there as of recent, not old, but stuff that's going on now. So it gets you thinking about your own health and wellness, the decisions and actions you might take today to support that health and wellness, or if you have some challenges and you want to get better, hopefully some of it directly pertains to you. All right. So the Journal of the American Medical Association Network Open, June 2021, talked about hearing loss and how that's tied to poor physical function. They looked at nearly 3,000 older adults and they found that seniors with hearing impairment not only had poorer physical function, but they also experienced faster declines in physical performance over time. The study concluded that hearing impairment is prevalent, but a treatable condition, and it may be a target for interventions to slow the decline of physical function associated with aging. So for many causes and types of hearing problems or hearing loss, a decline in the ability to hear well, there are some aids that can help, and if someone pursues those and utilizes them, it may help to maintain a component of their physical function. So for ourselves and those around us, we want to know that that's a valid treatment approach, and we should have that looked into. Aging Research Reviews, June 2021, looked at melatonin and how this time not only with sleep and mood, but can also help manage degenerative discs, perhaps. In addition to helping improve sleep, melatonin also inhibits inflammatory processes and aids in the removal of free radicals. In a recent paper, researchers speculate that improving melatonin levels via supplementation may assist in the management of intervertebral disc degeneration, and as patients have been found with disc degeneration to have lower melatonin levels. So a correlation perhaps there. Interesting connection between those two things. Brain Sciences, July 2021, looked at Parkinson's symptoms and how they could be slowed down by dancing. Patients with mild to moderate Parkinson's disease who participated in dance classes for 75 minutes a week over a 3-year time period experienced fewer daily motion issues than those who maintain their usual lifestyle. So motion, we know, activity, not only exercise and fitness, but even just getting our body moving in different ways like dancing has a positive effect on our fitness, but also stimulation to cognitive function. In this case, may help to slow Parkinson's symptoms, which is awesome. There's an article here from General Psychiatry, April 2021, looking at HIV and AIDS. And if you have a particular interest in that area or know someone who might, you can look up the correlation they found there and share that as necessary. And finally, BMC Public Health, July 2021, looked at sun exposure and how getting more of it may help reduce colon cancer risk. Researchers reviewed data from over 185 countries and discovered a significant association between living at higher latitudes, which can affect vitamin D levels due to less sun exposure, and an elevated risk for colorectal cancer for those over the age of 45. So they need to do some further research to determine if supplementation to improve vitamin D status can mitigate the risk of colorectal cancer, but they certainly did find a correlation. Did I say that was the last one? Not quite. There's another one from Physiotherapy Research International, May 2021, talking about shoulder pain and shoulder problems and how receiving shoulder mobilization could benefit with that shoulder condition pain. Subacromial impingement is a type of syndrome that occurs when the rotator cuff tendons become inflamed or irritated as they pass through the subacromial space, which can lead to pain, weakness, and reduced range of motion in the shoulder. The shoulder is one of the more complicated joints in the body, along with the hip and knee perhaps, although they all can be challenging in some ways, but function very beautifully when everything is working well, but some of the parts follow convoluted paths that require appropriate position in order to function well. And when those changes occur to how it's sitting and moving, problems can result to those parts of the different joints, including the shoulder. So a recent study found that glenohumeral or shoulder joint mobilization, getting that ball and socket joint manipulated or mobilized and moved, a form of treatment provided by many manual therapists, including chiropractors, resulted in improvements in shoulder abduction, lifting the arm at the side, and improved self-perceived change in health over time, even among patients who did not initially respond to treatment. So generally, joints do benefit from mobilization therapy, especially if they're dysfunctional and or if there is pain there. There's usually a component of something not sitting or moving right. So well worth getting assessed and addressed. So there you have it. That's your daily health update for Tuesday, to start your short week here in Canada, but to keep your week going perhaps elsewhere. And we'll be back tomorrow as usual, supporting your health and wellness decisions, choices, and actions, so you can keep having those great experiences you would like to have every day. So get out there today if you haven't already, and create some of those great experiences. We hope your day goes well. We'll catch up with you tomorrow. Take care.